This is a 360 view of the room that I will be performing my focused assessment in. Hi, my name is Morgan. I'm going to be your nurse today. Can I take a look at your wristband? And can you tell me your full name and date of birth?
Catherine Ashwell, 4/27/2002.
Do you have any allergies?
Nope.
And what are your preferred pronouns?
She, her.
This is the correct patient name, date of birth, allergies, and pronouns to be identified with. Today I'm going to perform a focus assessment on you. It'll last about 5 to 8 minutes and I'll explain everything thoroughly as I go. But if you have any questions or feel uncomfortable at any time, please let me know.
Okay.
The patient understands the purpose of the exam. Could you please put this gown on with the ties in the back? Are you comfortable in this room in regards to warmth and privacy?
Yes.
The patient is comfortable and prepared for the exam, and she is comfortable in the room in regards to the surroundings. I'm going to start by just asking you a few questions. Are you currently or have you ever been a smoker?
Nope.
Do you have any problems with your lungs or your breathing or any chronic respiratory diseases?
No.
Do you have any problems coughing?
Nope.
And have you experienced any shortness of breath or pain when breathing?
No.
If the patient were to report any of these symptoms, I would further assess using Old-Cart's ice, and I would also assess using techniques for special circumstances. Now I'm going to look at your chest and assess your breathing, if you could just breathe normally. The patient appears to be relaxed and at ease. She is sitting upright and her breathing is effortless and quiet. There are no accessory muscles in use and no bulges or retractions are noted. Her skin is pink, which is appropriate for ethnicity, and there are no moles, freckles, or lesions noted. And continue to breathe normally, please. The patient's respiratory rate is 18 and regular. Now I'm going to look at your oxygen level and place this probe on your finger. The patient's oxygen saturation is 98%. And now I'm going to assess your lips and your nails. The patient's lips and oral mucosa appear to be pink. The patient's nails are pink and her nail beds are 160 degrees. Now I'm going to ask you to please face this way and I'm going to look at your back and assess your breathing. The patient's ribs slope downward at a 45-degree angle. Her thorax is symmetrical and her scapula are symmetrical. Her spine is straight and her developing musculature is equal bilaterally. Now I'm going to be using my stethoscope to listen to various areas on your back. If you could please cross your arms over your chest, and then each time I place my stethoscope, I ask that you please take a deep breath through your mouth, a little bit deeper than you would normally breathe. And I'm going to ask that you please face this direction. Thank you. And one more time, deep breath. Breath sounds are heard equally, bilaterally, and clear on all of the lung fields of the posterior and lateral chest. These vesicular sounds appear to be normal in all of the lung fields. There is no presence of any wheezes or crackling, and there are no other adventitious breath sounds. Now I'm going to assess your chest the same way that I just assessed your back. The patient's thorax is symmetrical. Her costal angle is less than 90 degrees. Her muscle development appears to be equal bilaterally, And her anterior, posterior to lateral diameter is at a ratio of 1 to 2. Now I'm going to be placing my stethoscope at various areas of your chest, the same way that I did with your back. Again, please just take deep breaths through your mouth a little bit deeper than you normally would breathe. Vesicular lung sounds are present over all of the anterior lung fields, and they are predominant. There are no crackles or wheezes heard. Her lung sounds are clear, and they are equal bilaterally, and there are no other adventitious lung sounds that were present. Now I'm going to ask you to please turn around again, and I'm going to use my palms to feel various areas of your back. If you feel any pain or tenderness upon palpation, please let me know.
Okay.
The patient's posterior thorax is non-tender upon palpation. The patient's vertebrae is non-tender upon palpation, and there is no irritation. The patient's ribs are symmetrical and stable, and there is no pain or tenderness, and they are firm. And now I'm going to ask that you just take a deep breath. The patient's posterior thorax expansion is equal bilaterally. Now I'm going to place my hands in various areas on your back, and each time I place my hands, I'm going to ask that you say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3.
The vibrations palpated are equal bilaterally. Now I'm going to ask that you please turn around and face this direction. And I'm going to assess your chest and feel various areas that are important, just like I did with your back. I will be lightly touching areas such as your throat, your collarbones, and your ribs. The trachea is midline and slightly movable. The clavicles are symmetrical, and the surrounding musculature is well developed and equal bilaterally. The rib cage is stable and symmetrical, and there is no pain or irritation upon palpation. And now I'm going to just place my palms of my hands in various places like I did on your back, and I'm going to ask you to please repeat 1, 2, 3 each time as I do.
1, 2, 3. 1, 2, 3. 1, 2, 3.
The vibrations palpated are equal bilaterally, and that concludes our exam. And this is another 360 view of the room that I just performed my focus assessment in.